I am Dr Samreena Sadaf, consultant pulmonologist. The topic I am going to discuss is smoking cessation. Smoking is not a lifestyle choice, it creates a dependent state. Nicotine addiction is a complex process. Quitting smoking leads to decrements in attention and cognition. Impaired concentration, thinking, and performance associated with nicotine deprivation are strong motivating factors to smoke. Smoking is a risk factor across an area of diseases, जिसमें most important cancer है lung cancer, oral cavity, pharynx, laryngeal, esophageal, stomach, pancreatic, kidney, bladder, cervical, and leukemias. Smoking is also risk factor for cardiovascular disease, including ischemic heart disease, stroke, vascular dementia, peripheral vascular diseases, abdominal aortic aneurysms, respiratory problems, COPD, community acquired pneumonia, or asthma. Reproductive health, erectile dysfunction, reduced fertility, pregnancy complications, low birth weight, syndrome of sudden infant death syndrome, other conditions may occur surgical outcome, hip fractures, low bone density, cataract, peptical diseases, metabolic. Global situation, tobacco use is a preventable cause of death in the world. In the 20th century, more than 100 million people died worldwide due to use of tobacco and tobacco-related products. 70% of these deaths occurring in the developing countries. Moreover, unless urgent action is taken, tobacco could kill 1 million people during this century. WHO estimates that 47% men and 12% women smoke globally. In developed countries, 42% men and 24% women are smokers, whereas in developing countries, 48% men and 7% women are smokers. Anti-tobacco laws in Pakistan in 2002, President of Pakistan implemented an ordinance by the name of Prohibition of Smoking in Enclosed Places and Production of Non-Smokers Health Ordinance 2001. According to this ordinance, no person can smoke or use tobacco in any place of public work or use. No person can smoke or use tobacco in any other form in any public service vehicle. No person or companies can advertise tobacco and tobacco products in any media, in any place or any public service vehicle. If such advertisement is not in accordance with the guidelines prescribed for this purpose by the committee formulated by federal government. No person can sell cigarettes or any other such smoking substance to anyone who is below the age of 18 years. No person can use or by any person on his behalf smoke, sell, or distribute cigarettes or any other such smoking substance within an area of 50 meters from any college, school, or educational institution. The owner and manager are in charge of the affair of every public place of public work or use shall stay in with or with the conspicuous place in any outside premises visited or used by general public, prominently stating that the place is a no smoking zone in which smoking is allowed. Any person who violates the law could be punishable with a fine which may extend from 1 to 5,000 rupees. In the case of second or subsequent offence, could be punishable with a fine which will not be less than 100,000 rupees or with imprisonment which may extend to 3 months or more. However, unfortunately, none of these laws are implemented in the true spirit. That's why the burden of tobacco use in our country is ever increasing. Key guideline implementation. Tobacco dependence is a chronic disease that often requires repeated interventions and multiple attempts to quit. Effective treatments exist, however, they can significantly increase the rate of long-term abstinence. It is essential that clinicians and healthcare delivery systems consistently identify and document tobacco use status and treat every tobacco user seen in the healthcare setting. इसमें काउंसलिंग और मेडिकेशन दोनों अगर साथ करें तो इसमें काफ़ी इम्पैक्ट होता है एज कम्पेयर टू अगर आप सिर्फ काउंसलिंग यूज़ करें या फिर मेडिकेशन करें. 3% medications reliably increase long-term smoking abstinence. इसमें निकोटीन है, Rehman and Rehman. If a tobacco user currently is unwilling to make a good attempt, तो आपने इसको future good attempts को effective बनाने के लिए motivational treatment करना. Clinical interventions for tobacco use independence. What can a health professional do as a doctor? हम क्या कर सकते हैं? Do not smoke or use tobacco. Take a history of smoking or tobacco use. Inform advice to patient to use tobacco. Learn how to counsel a patient in order to make them quit smoking or tobacco use. Educate the public regarding the hazards of active and passive smoking in other forms of tobacco use. The 5 A's approach इसमें सबसे first है ask about the tobacco use, identify and document tobacco use on every visit. Advise to quit in a clear, strong and personalized manner. Urge every tobacco users to quit. Advice करने के बाद आपने third A is assess willingness to make a good attempt. If he is willing at this time, then assist him. अगर willing नहीं है तो give motivational treatment for the next attempt. Then arrange follow for the patients willing to make a good attempt. इसमें अपनी usually ideally the first week follow up arrange करना है. Or patients are willing to make a good attempt at this time, address to whether dependency and willingness to quit at the next visit. This is the 5 hours for patients unwilling to quit, promoting the motivation to quit. इसमें relevance encourage the patient to indicate why quitting is personally relevant in as specific as possible. Motivational information has the greatest impact if it is relevant to the patient's disease status, or risk, family, and social situation. For example, having children at home, health concerns, age, gender, and other important patient characteristics. उसके हिसाब से पेशेंट के सिचुएशन के हिसाब से अपने रेलिवेंट काउंसिल करना है. रिस्क clinicians should ask the patient to identify potential negative consequences of the tobacco use. The clinician may suggest and highlight those they see most relevant to the patient. इसमें acute risk है, long term risk and rheumatoid risk. Acute risk में shortness of breath, exacerbation of asthma, increased risk of respiratory infections, harmful pregnancy, impotence, infertility. Long term risk में heart attacks and strokes, lung and other cancer, COPD, osteoporosis, long term disability and need for extended care. Environmental risk में increased risk of lung cancer and heart disease and spouses, increased risk for low birth weight, sudden infant death syndrome, asthma, middle ear disease and respiratory infections in children of smokers. Rewards. The clinician should ask the patient to identify the potential benefits of quitting smoking. इसमें examples of important rewards may include health, meal taste better, improved sense of smell. Fourth are is roadblocks. Clinician should ask the patient to identify the barriers to quitting and provide treatment. They could address these barriers. Typical barriers include withdrawal symptoms, fear of failure, weight gain, usually 3 to 4 kg weight gain होता है quitting smoking. Lack of support, depression, enjoyment of tobacco, being around other tobacco users, limited knowledge of effective treatment options. Fifth is repetition. The motivational intervention should be repeated every time an unmotivated patient visits the clinic setting. Tobacco users who have failed in previous quitting attempts should be more than most people make repeated quit attempts before they are successful. Counseling patient. इसमें अपने पेशेंट को बताना है कि निकोटीन एडिक्शन इज मोर लाइक ए क्रॉनिक रिकरेंट डिसऑर्डर विद एन एक्सपेक्टेड सक्सेसफुल सेसेशन रेट आफ्टर ट्रीटमेंट 50 to 35%. After 1 year, it's similar to other related disorders. इसमें निकोटीन withdrawal symptoms अपने एक्सप्लेन करना है पेशेंट को कि ड्यूरिंग फर्स्ट 2 weeks ज़्यादा सिम्टम्स आते हैं. इसमें पीक इन जो है 7 to 10 days में ज़्यादा ये निकोटीन withdrawal symptoms में इंसानिया है, headache, irritability, lack of concentration, weight gain, ये सारी चीज़ें उनको समझाना है और साथ ही बताना है कि these symptoms are temporary. Within 2 weeks इसके बाद आपको आहिस्ता आहिस्ता कम होना शुरू हो जाएंगे. इसके अलावा सिम्टम्स को कम करने के लिए हमारे पास मेडिकेशंस हैं और इससे इफेक्टिव हो सकती है. एंड बेनिफिट्स ऑफ क्विटिंग स्मोकिंग वी आर ऑलरेडी डिस्कस्ड. इंपॉर्टेंट क्विटिंग स्टेप्स इसमें सबसे पहले अपने क्विट डेट सेट करना है. आइडियली विदिन 1 to 2 weeks of consultation with health professional. Second, telling friends and family. It really helps as in this way the patient is not alone when he or she gets companion more against tobacco. Changing routine and removing reminders like household reminders such as ashtrays should be removed and the daily routine should be changed. हम इनके साथ में स्मोकिंग करते हैं वो रूटीन आप थोड़ा चेंज करें. फॉलो विजिट्स विदिन 7 routine days of this could be this is the time when smokers are having maximum nicotine withdrawal symptoms and physician may be able to help in reducing of their concerns. Nicotine replacement therapy is the first line. Minimize short and medium term nicotine withdrawal symptoms should not be used while still smoking is potential for nicotine overdose. The different forms may have gums, patches, lozenges, sublingual tablets, lozenges, inhalers and nasal sprays. Nicotine gums 2 mg and 4 mg उनके नाम आता है. It depends on the number of cigarettes per day. Adolescents 20 cigarettes per day 2 mg वाला they लेना है. अगर more than 20 cigarettes per day या more than 15 pieces of 2 mg gum needed, then up 4 mg gums use करें. Maximum 15 pieces of 4 mg gums per day use कर सकते हैं. Use for 3 months and reduce the strength and amount of gum use. और इसको निकोटीन गम्स अचीव करने के लिए भी स्पेशली आपने इंस्ट्रक्शन देनी है कि जब हम गम चीव करते हैं और उसमें पेप्री या मिंट टेस्ट आता है तो अपने इसको पार करने बिटवीन बकल म्यूकोसा एंड जॉ, और जब तक वो टेस्ट खत्म नहीं होता प्लेस को ऐसे ही रखना है क्योंकि सब लेके जो म्यूकोसा के थ्रू में निकोटीन की एब्जॉर्प्शन होनी चाहिए। Nicotine patches 5 to 15 mg में available है. If more than 10 cigarettes per day, use a higher dose patch used for 6 to 8 weeks and the higher dose and mean to lower dose for 2 to 4 weeks. Prescribing instruction at the start of each day, patient should place a nicotine patch on their relatively careless patient, typically between leg and waist. No restrictions on activity while using the patch. Patches should be applied days to let the patient wake up on their midday. In patients who experience sleep disruption, advise the patient to remove the 24 hours patch prior to bedtime. या फिर आप 16-hour patch यूज़ करें. Dosages का है, इसमें भी नंबर ऑफ सिगरेट्स है, more than 30 cigarettes per day, 2 mg dosages यूज़ करें, अगर less than 30 है तो 1 mg. और sublingual tablets है, 1 to 2 tablets should be placed under the tongue every hour to minute. Licensed for use in pregnancy, 1 tablet only. Available and prescription. Inhalators usually जो hand drops उनका आदि होते हैं उनके लिए ज़्यादा अच्छा होता है. Nasal spray, faster dropping in another forms of NRT और craving के symptoms को जल्दी इसमें effective होते हैं. Precautions for use of nicotine replacement therapies में pregnancy, lactating women and cardiovascular disease. Although कर सकते हैं लेकिन precautions हैं. Side effects में mouth soreness, hiccups, dyspepsia, jaw, externally mildly transient can often be alleviated by therapy patients to technique. Second drug, this is also first time, bupropion, Zydex 75 mg, Zydex 1.3 mg के नाम से आता है. Mechanism of action deeply inhibits dopamine, serotonin and noradrenaline receptors in the CNS. It counteracts nicotine withdrawal symptoms by increasing these levels in the brain. Dosage, it is recommended the patient begin with a dose of 150 mg for 3 days and increases to 150 mg twice daily for 7 to 12 weeks. और इसमें bupropion और permethrin के quit date से 1 to 2 weeks before of the start करनी है और maintenance treatment can be used up to 6 months. Contraindications, seizures, eating disorder, patients taking daily monoamine stays inhibitor and pregnancy. Vernaculine 0.5 mg Vernaculine tablets में available है. Mechanism of action targets nicotine style polyreceptor in the reward system in brain, where it acts as a partially released to alleviate symptoms of craving and withdrawal. Recommended dose of Vernaculine is 1 mg twice daily, following a 1-week titration is below. First 3 days with 0.5 mg once daily, 4 to 7 day में 0.5 mg twice daily, day 8 in treatment 1 mg twice daily. Precautions इसमें no hypersensitivity, pregnancy and lactation में precautions. These are second-line medications, clonidine, nortriptyline. Possible future options में rimonabine, cysteine and nicotine vaccines available. Electronic cigarettes are battery-powered and vaporizing nicotine and other chemicals in a liquid solution to an aerosol mist. The nicotine content is approximately the same amount as in a separate cigarette. There is lack of high-quality evidence of their use in smoking cessation. Although some studies suggest that they help smokers decrease cigarette consumption even they do not intend to quit. The long-term effects on pulmonary health are unknown. The Royal College of Physicians have advocated the use of e-cigarettes as a direct to harm reduction.